Welcome back, everybody. I hope that you were able to make some great connections and take in a few sessions today. And thank you for joining us for our closing session that's hosted by Digital Health Canada, Canada Health Infoway, and the Canadian Institute for Health Information, which will highlight how the co-hosts are collaborating to accelerate a better experience. To get started, I would like to introduce all of the panelists in the order that they'll speak. So joining us on the stage today are Angela Lianos. Angela is the Senior Director of Healthcare Consulting at PwC and also a Digital Health Canada board member since 2020. Angela has spent over 25 years working in the healthcare industry, working with acute care facilities and healthcare policy organizations, and 20 of those have been spent working in IT across the country for hospitals, software vendors, government, and government agencies. Angela also works as an adjunct lecturer at the University of Toronto for the Master of Health Informatics program and is a member of the Finance and Audit Committee for the Digital Health Canada's board. So welcome, Angela. You're a little bit busy. Next, we have Abby Kalra. Abby is the VP for Portfolio Management, Virtual Care Programs at Canada Health Infoway, and has experience in designing, establishing, and executing large-scale, multi-year, transformational digital programs that deliver value across healthcare providers, patients, and provincial stakeholders. In his current role, he's responsible for building out the strategy to advance pan-Canadian digital health interoperability, the standardization of health data, to drive adoption of digital health solutions and improve patient and clinician experience with digital health solutions. Also a lot on the go. And last but not least, we have Brent Diverty. Brent is the Vice President of Data Strategies and Statistics at CIHI. He has executive responsibility for CIHI's range of health services, expenditure and workforce data holdings, and many of the standard information products that flow from them. Over his 20-year career, Brent has worked on both supply and demand side of data and information, in most cases with a focus on health services and population health. He holds an MA in economics from McMaster University with a specialization in health. So welcome to all of you. And I think for our attendees, we definitely qualified our panel as experts. So welcome again, and we're looking forward to get started. But as we do that, I'd like to give you a bit of a heads up that this will be an interactive session. And we hope to hear from you through some polling that will take place during the talk. So please get ready for that. And then following the presentation by our speakers, we'll have some time for open question and answer. So I would welcome you to start getting your questions and your insights together so we can share them through the chat box at the side of your screen. So with those logistics in place, let's get going. And I would like to welcome Angela to the screen.
Thank you so much, Cassie, for the introduction. Hi, everyone. Health system data, shared challenge and shared response. So spoiler alert on our issue, health system data doesn't flow seamlessly across the continuum of care. I know you've all experienced that in your various roles. And that is true for irrespective of the way that care is delivered, whether it's in person or virtual. And we hear this from both patients and providers that having access to a comprehensive health record still remains a bit elusive, it's limited, and when the information is available, it's not often timely and it's not often available in a standardized format or comparable in a way that would help us make use of it for health system management. So we clearly have some opportunities here. If we look at, for example, acute care or emergency care data, some of that data is partially standardized and it flows and is shareable to some extent, but again, it can be difficult to collect and not very timely. So through our collective experiences, we've come to understand that if we are to address these issues in a successful way, we're going to need to be coordinated in our efforts and coordinated in our investments as well. All of us have worked in jurisdictions where it seems like some of that investment is counterproductive, almost leading to greater disparity. And we know as well that this is going to take us some time, and improving that interoperability is going to be a multi-year initiative. So with that, we have some questions for you. We've got 3 questions actually. And the first poll that we would like to conduct with you is to help tell us what best describes your knowledge of interoperability. Are you knowledgeable and actively working on things related to it? Are you knowledgeable about it, but not directly working on initiatives related to interoperability? Are you aware of it? It's kind of over there, but you don't have enough knowledge of it, or have you never really heard of it? And we'll come back at the end with some of the responses. Our second question to you is a little bit more personal, if you will. Have you or a family member had a gap in the coordination of needed care due to a lack of information sharing amongst your health providers? And so this one is a yes/no question. I think that for most of us, we know what the answer is and whether we've experienced that ever during our care journey. And then as you are filling out the answer to that, we will go in a moment to the third polling question. Also around your more personal health experience, have you or a family member had an experience where you had to repeat a test, specifically a lab or a diagnostic image, because your healthcare provider couldn't locate your most recent results? So again, feel like we might know the answers to all of this. We've all made great strides in being able to make this information accessible, but interested to see what you'll say, and I will share some of the results as we continue through the course of today's presentation. But in the meantime, let's talk a little bit about what the clinician perspective is as it relates to the progress that we've made and the existing gaps. You'll see on the right-hand side that over 9 in 10 physicians provide virtual care, and that can be anything from telephone on the left, moving to video and secure email and messaging. You'll also see the growth over the last year or 2 years as it relates to providing that virtual care. On the left-hand side, talking a little bit about primary care EMR adoption, you'll see over the course of the last 13 years, great strides have been made at that, where we're sitting as of last year at over 90%. But as we go to the next slide, and in spite of some of that progress, you'll see on the right-hand side that red line that speaks to the ability to send clinical summaries from an EMR. So while the adoption of the EMRs remains high, there's still some of that functionality and that sharing that is not quite happening. And you'll see on the left side as well, when we look at physicians' use of electronic communication tools, starting with access to test results sitting at 78%. But as we start to cross care settings, as it relates to sharing clinical summaries, as I indicated, or even being able to renew a prescription directly with a pharmacy, those numbers start to go down over time. So again, speaking to that gap in interoperability. As we move on to show you some other statistics, you'll see on the right-hand side, Canada is trending higher as it relates to being able to electronically exchange, we're speaking about clinical summaries here, with other doctors outside of their practice. In 2019, when the international survey was done on the left side, you'll see that we sat at 22%. Not very high, and certainly not high related to some of our other peers in some of the other countries. So while we've raised that number to 34% over the last 2 years since the survey was conducted, it speaks to the level of work still required in order to be able to exchange that information in an electronic way and provide that information to other care providers. As it relates to what are clinicians thinking and their thoughts around efforts to improve interoperability? Well, there's certainly advocates for it. They believe that safer patient care would be enabled if they were able to access information in a more complete and timely way. That interoperability would be improved because they would be able to coordinate care better with other care providers. We're always talking about the fact that transition of care settings are so important as it relates to taking care of patients. And 85% believe that their own productivity would be improved by having this improved interoperability. So not only is it both the clinician's own priorities and productivity, but right to patients and health system, which speaks to interoperability being a component of the quintuple aim as well, patients, the system, and providers as well. If we go to our next slide, you'll see that patients more or less feel the same way. They would like, they believe that they're more informed about their health and better manage to own health when they have access to that information. 93% believe that or feel that they would like to receive their lab results immediately. And then we let off a little bit with virtual care services and how those are being provided. And you'll see that in 2021, a full 59% of Canadians made use of at least one virtual care service. And we saw that trend line grow, especially during our COVID years. And then as we wrap up with our survey results, from a patient point of view, again, if patients saw a specialist, did they feel that some of the basic information was missing, or their doctors seemed less informed? And from a Canadian point of view, those numbers were relatively high as well, but I think we're working on them. And it would be nice to see what our poll results are as it relates to that. And while we get that, let me just lead with the rest of the presentation. We'll do that when we have all of the results. But for the purposes of today's conversation, we really want to obviously say that access to the information is limited. The health system data doesn't flow seamlessly, and that holds true for all kinds of care, whether it's in person or virtual, publicly funded or privately funded or delivered. I'm thinking of private labs, and whether that data is being used for clinical use or health system use. And then, of course, we have complications around ownership and portability of information. But for the purposes of today, we are going to be talking about digital health interoperability. And on that note, most of you are knowledgeable and actively working on it. So I hope that this is a timely session for you. And we'll share the other results with you over the course of this presentation. So in the meantime, I'm going to hand it over to my colleague, Abby, who will continue this conversation from a Canada Health Infoway perspective. So Abby, it's over to you.
Thank you, Angela. That was a great presentation, and especially some of the impactful stats, that you shared about the Canadian health system. So quite fascinating stuff there. And I managed to pick the second stat or second survey question, wherein while it was still in progress, about 90% of the respondents felt that there was a gap in the information. So it's quite concerning, and I think the interoperability in digital health space is quite a relevant topic for that. So on the next slide, I want to talk about through our various extensive consultations that we have gathered till date. We all know that Canadian health system, the stakeholders, they desire outcomes in which point of care, transition of care, clinical collaboration, and health system planning, they are really required, and they need to be supported by a secure real-time data exchange. So from a patient and provider outcome standpoint, a seamless and timely access to all the relevant personal health information and point of care would definitely create a much safer and better patient experience. Clinical collaboration and transitions of care, wherein the clinical systems can actually communicate the information amongst themselves efficiently and securely, is a great outcome that I'm sure everybody's looking for. And the third, the key part of patient information is patient health information should be readily available and accessible to all Canadians. In an ideal world, of course, we would want every Canadian to be able to access their electronic health record from wherever they're able to. And then focusing on the health system outcomes, near real-time data, the importance of availability of a near real-time data to help with some critical planning, for example, a hospital capacity as we saw during pandemic, or opioid poisoning, etc. It helps the decision makers to make important decisions in a timely manner. And then from an innovation standpoint, a standardized common data sharing standard, if made available across Canada, it'll reduce the barrier for entry for the vendors and innovators while ensuring a diverse and innovative digital health ecosystem. So on the next slide, I'm going to talk about why we believe and we all know that given that 56% of the people are extremely knowledgeable about interoperability, and remaining 30% also believe that they're actively involved in projects. There are a number of enablers to achieve the outcomes that I covered in the last slide, but interoperability is one of the key enablers. It's that intangible enabler behind the scenes that is required to make these outcomes realized. So standardize the data, enabling the secure exchange of data. These two enable the final outcome, which is providing its citizen. It will enable the health system to provide its citizen to easy access to their health information in an electronic manner. That's the key word there, the digital format, the electronic manner. And now, if we all believe that, yes, interoperability is one of the key enablers on the next slide to a connected and efficient healthcare system. So why is that, we're not able to actually address it in its totality? There has been progress. There's been a great progress over the last few years. So why is that we've not been able to actually meet and deliver it totally? And again, across the globe, Canada is not alone. Every single country is grappling with this problem. These are the 5 common barriers, that the countries are actually grappling with in terms of addressing the interoperability. So let's just quickly go through technical barriers. Every single clinical system, there is some sort of variability and lack of harmonization of standards, whether it's the data standards, whether it's the exchange standards, or whether it's the terminology standards. So there is a need to continue to harmonize those standards. Trust barriers. There are legal and business incentives, that block interoperability progress. So health data is being looked upon as a competitive advantage, by organizations, by vendors, by other stakeholders. So by setting a common principle, terms and conditions to facilitate the trust between health information network, it creates a win-win scenario. Clinical workflows and usability barriers. You would all agree that all systems are designed differently. But that's fine. But the clinical workflows, if you start to see a huge degree of variability across those flows, then it results in poorly and inconsistently capturing of the data. Financial barriers, the industry regulations, the reimbursement programs, if you bring all of that into place, the organizations, the vendors, the stakeholders are struggling to actually keep up with the financial pressures. There is purchasing the licensing, upgrading the systems, optimizing the IT, and especially in a health system, which is spread across and fragmented, vendors have to deal, with multiple variations, when it comes to their product roadmap. So how do we actually align that together? Policy barriers. Again, policy is usually a lengthy process to go there, but yeah, if it's needed, we should be able to bring that in to help. As for example, ONC brought a 21st Century Cures Act, to deliver the free flow of or blocking of data. Again, on the next slide. So I already covered, number of organizations or number of countries that are going through it, whether it's the Australian government, whether it's the NHS or it's the ONC in US, they're all currently dealing with this problem, and they are all trying to advance in some way or the other. The common element that we have witnessed in each of these countries and their interoperability framework is having a need for a central agency to put together an interoperability framework, a common interoperability framework that everybody could stand behind, support, and actually advance it together. So that's the key thing. Infoway has been investing in number of projects, which are towards advancing the interoperability over 20 years. It has actually acquired deep-rooted knowledge and skill set in that area. So we're well positioned to take this forward in conjunction in working, with our stakeholders, our partner organizations, PCHOs, and federal and provincial stakeholders. Some of the key ingredients of pan-Canadian interoperability, and again, this is not something that we are defining. This is something well used and adopted everywhere else. A need for common pan-Canadian governance, wherein the common goals are aligned and agreed to and monitored. The development of a pan-Canadian roadmap. What are the shared priorities? What is that everybody is going after? Alignment on that and governing that roadmap. Clear publication of the data exchange and terminology standards. A national vendor management program that supports the vendor in terms of making the standards available, but also ensuring that the conformance is done in a unified standard way. Publishing common procurement requirements for interoperability, whether it's a functional, security, privacy, the data standards, data models, all of those things should be easily published, which will help the vendors, the existing as well as the new vendors. And then finally is the trust exchange model, working with the PTs to develop a common exchange model that actually facilitates the exchange of information in a secure and safe manner. How do we do this? I mean, Infoway alone cannot do this. It requires, it takes a village to move it forward. But given CaiHi and Infoway, they are in data space, terminology, data standards, and data model space. So they have been working together for years. And they have demonstrated a great partnership, even currently on advancing some of the key programs, the organ donation transplant program, which is one of a national interoperable platform that we're trying to actually procure for all our jurisdictions, and building those interoperable interfaces to the other systems so that the information can be exchanged. So that's a great testimony to the partnership that the two organizations have actually demonstrated, and continue to develop the EMR-based standards, the minimum data set. That's another key thing. To pack everything that I presented in the last few slides, you can see on this picture on the top half, from a patient and provider standpoint, the real benefit realization in the interoperable healthcare sector is availability of information during an emergency, availability of information so that a coordinated, connected care could be provided, a seamless flow of information so that the physicians and the healthcare providers can actually provide timely treatment to everyone. And then if you see in the bottom half, there are a number of stakeholders. The ones in red, the activities that Infoway as an organization has been driving. In teal, the activities that CaiHi has been driving. And blue, the stakeholders, the provincial and the territorial stakeholders, they have to own their infrastructure and drive it. And then in the bottom, you see a pan-Canadian governance that actually advances the overall machinery. So everybody, at the end, everybody has to come together and in a coordinated, collaborative, and organized way to move it forward. So with that, I will pass it on to Brent. I'm a little bit over a minute, and we'll come back for Q&A. Over to you, Brent.
Thanks, Abby. I'm happy to share a minute with you for sure. It's a pleasure to be back at eHealth, albeit virtually, and I'm honored to share the screen with these colleagues and partners to discuss this ever important and timely topic. Collaboration with many health system partners will be necessary to achieve digital health interoperability. We've often heard it, the ideal flow of health data referred to as a pipeline, so we've run with that as an analogy in this slide. As Abby alluded to, CaiHi and Infoway have related but distinct roles in enabling patient and provider access to patient records. The left-hand side of this tab on the primary focus of Infoway's work, and in the creation of data for health system use and research, the right-hand side tab, the primary focus of CIHI. In terms of inputs and supports for this pipeline at the pan-Canadian level, Infoway leads with terminology and exchange standards, interoperability architecture, a national procurement program, and vendor certification and conformance. Well, CaiHi has a pivotal role leading the development of data content standards, data and information methodologies, and health system performance indicators for reporting. And with a foundation of stakeholder engagement, governance, and a privacy and security framework, we're both focused in a complementary way on developing high-quality standardized data for patient care, patient access, system management, and research. So CaiHi and Infoway are at the early stages, as Abby's noted, of collaborating on a digital health project to improve to support the improvement of interoperability of primary care and acute care information. As we've noted, each organization has a unique role in the data pipeline, and we are leveraging the expertise of each organization in this effort. An example in primary care is the International Patient Summary, an Infoway-led initiative and key to enabling provider and patient access, and the primary care and acute care minimum data sets that are CaiHi-led, designed to enable health system uses of the data. Increasingly, the data standards for what were traditionally called primary and secondary uses need to, at a minimum, be integrated, and more often are converging into one and the same. Standards are the backbone of a connected, patient-centered, patient-centric health system, and data content standards have many benefits in this regard. They facilitate the design of data and collection tools, ensure quality information, enable data linkage, improve comparability between different sources, and reduce costs associated with data creation and transformation. And standards ultimately allow for better care and improved patient and provider experiences and outcomes, and comparable pan-Canadian data to support system management and policy change. Infoway and CIHI are part of a larger standards ecosystem made up of a number of stakeholders, many in this audience, who each have a role in development, management, maintenance, and implementation of standards in Canada. And thanks to our co-host and partner, Digital Health Canada, for bringing us all together and providing us with great information about the current environment. If you have a role in your organization in standards, you're part of this collective that must work together to support standardized data and work towards improved interoperability. Of note, standards provide certainty and scale opportunities to the digital health vendor community, a critical partner in this journey. So if you're less familiar with CIHI, here are a few facts about our organization that outline our role in supporting interoperability. We've had a leadership role in the development and maintenance of data content and information standards since our inception 28 years ago and in our legacy organizations. Guided by a standard strategy for agreed upon data content standards, we provide a pan-Canadian perspective on implementation and plan standards development enhancement projects. Our responsibility includes minimum data sets for all care standing, long-standing ones, or all care settings, long-standing ones, such as acute care and emergency care, our famous DAD and NACR standards, but also long-term care and home care through the InterRI clinical assessment instruments, and newer standards, including our primary care EMR data standard. We also maintain certain classification and terminology standards embedded in our minimum data sets, ICD-10 and CCI for diagnosis and interventions, the MIS standard for healthcare finances, plus standards to describe the health workforce and macro healthcare expenditures. We also maintain a range of information standards, algorithms, simple and complex, to support primarily health system uses, including system management, planning, quality improvement, funding, etc. Our standards are developed and maintained. Our standards are developed, maintained, and enhanced through pan-Canadian advisory structures and other forms of stakeholder engagement to achieve consensus on standards and solution requirements. And as I noted previously, we've historically focused our work on health system uses, but these standards are also increasingly applicable at point of care and to enable patient access to their record. Hence the importance of the partnership with Infoway and the broader standards ecosystem. So today, across our 3 sets of remarks, we've talked about the challenges and barriers, as well as the enablers to achieve improved interoperability. It's going to be a journey, but with significant collaborative effort from all of us, we will reap the outcomes and benefits of a more connected health system with patients at the center. Specifically, advancing towards a world-class health data system, improving care through rapid, secure exchange, empowering patient and provider access, providing more complete and timely data at less cost for health system measurement, reporting, and research, fostering digital health equity, enhancing public health surveillance, meeting Canadians' expectations that their data is appropriately used, and starting with the hospital and primary care settings, building a foundation that can readily extend to other digital health opportunities. And with that, I'll turn it back to Cassie to further our discussion with all of you.
That's great. Thank you, Brent. So I'm going to get everybody to come back together on the virtual stage here so we can have some discussion. And as we're doing this, I encourage all attendees to type in their comments and questions in the chat box at the side of their screen. And as we wait for some questions to come in from the audience, though, I'm going to get this exchange started. And Angela, I'm going to hit you up first. So I'm reflecting on the complexity of data and digital health interoperability. And I'm appreciating the references that were made about our collective journey, a multi-year journey, a multi-stakeholder effort. And with that latter aspect of stakeholder engagement in mind, how does Digital Health Canada bring the right voices to the issue?
A number of different ways. Digital Health Canada has a training and certificate programs. That's definitely one way. But I think about examples like today, creating these forums where we can come together, exchange knowledge and ongoing thought leadership. And if things like today or other webinars and knowledge exchanges aren't proof enough, very tangibly, I can also point to what Brent talked about, which is the International Patient Summary white paper, which came as a as part of a collaboration with Chief, which for those of you who know are senior leaders who are part of Digital Health Canada, in collaboration with Canada Health Infoway, to put this paper together to talk about the value of the international patient summary and to further its understanding as it relates to achieving interoperability. So those would be some of the ways that Digital Health Canada is helping to facilitate that stakeholder engagement and provide those opportunities for knowledge exchange and thought leadership.
That's great, thank you. Certainly a lot of value to come, and Digital Health Canada has a very broad member association and representation, so lots of voices and perspectives that can help to move this forward. So Abby, while we're waiting for some questions, you're not getting off easy, I've got one for you too. You spoke about foundational building blocks that can be developed in partnership with key stakeholders. And I think an important message that we've heard, but is good to highlight to our attendees today, is that this work is not starting from scratch. So much good work has happened. You guys mentioned some examples, and there's a lot underway right now, and it puts Canada on the right foot forward. So can you share a little bit more about some of the related interoperability work that Infoway's conducted in partnership over the past year?
Yeah, sure. So I did touch on the fact that, Infoway has been actually investing and supporting the jurisdictions in building the interoperable solutions for the last 20 years. But recently, if you see last year, we took on the challenge of advancing international patient summary in Canada. I mean, as you know, IPS has been very successfully implemented across Europe, and it's making its way in North America. So we took on the IPS standard and brought the collaborative team together across the jurisdictions and came up with a common set of 10 Canadian IPS standard, the patient summary standard, which are jurisdictions and the stakeholders and the vendors could take and implement. And the key idea was pan-Canadian. It was a collaborative effort to bring everybody together to arrive at a common set of specification, and that manifested into a common standard, that we could now take and actually advance. So that is a journey. It's not over. It's a multi-year journey. We started the first one, and we did the projectathon and brought the vendors. Then the second, as you know, electronic prescribing platform, the digital medication, that is something which has been well underway, and it's truly a national interoperable platform, that we built. So we made tremendous progress there last year, and the standardization of the data terminology, the data contents, and the data exchange standards, that we are actually we're preaching or recommending as part of the work. And third is the organ donation and transplant program. So in collaboration with Kai, I touched on briefly, it is truly has all the elements of the foundational elements of interoperability, whether it's a national procurement, common solution, common negotiation with respect to the licensing, and one common platform for disease donation management and transplant living donor management that will be deployed across all the organ donation organization sites identified across multiple jurisdictions. So you could see, and it's grounded. The solution is grounded in interoperable specifications for data as well as exchange standards. So as you could see, these are the things that we have already been we've done recently or started recently that will actually manifest into a more significant strengthened pillars, the 6 pillars that I talked about in my presentation.
That's great, and certainly highlights that idea that there's a lot of work underway and lots to keep building from. So that's really reassuring. Brent, I'd like to direct this question to you, and I'm thinking about Kai-Hi's leadership in data standards, and wanted to ask you how the work underway for some of your standards you mentioned, such as the primary care data standard, support the focus on the patient summary that we've been talking about here more specifically.
Thanks. Happy to talk more about that area. So, I mentioned we've been working for several years on a data content standard for primary care physician EMRs, with a lens to it being for system management purposes, to fill an important data gap in system management about the activity going on in primary care. Infoway picked up the International Patient Summary as an important standard for supporting the exchange of information between care providers and patients. So you can think of that as almost sort of their sort of portable health record, so to speak. And it became increasingly clear there is considerable overlapping content between these two items, which were designed for different purposes. So the first thing we wanted to think about is making sure that the overlapping content in them is the same, and that the standardization would be important, but also to look at the unique content that might be needed or appropriate for patient care or patient access, and the unique content that might be appropriate for system use purposes or system management purposes, and make sure that's also necessary and needed, and also harmonized as well where appropriate. So you can really think of this as an opportunity to harmonize our content standards and to rationalize them as well, recognizing that creating data can be costly, and it needs to be efficiently done. And you can apply this same example, I think, to other care settings. When we have some much longer standing content standards in Canada, I mentioned in the hospital setting, for example, we can apply the same example there. And we can also, of course, think about it in future in future applications as well, again, to make sure that over time and increasingly we see standardization, not just between a care delivery and a system use in one setting, but also start to see more standardization across settings as well.
That's great, Brent. That is really helpful, that example, and really nice to see the goal of the connection, and like you used the word harmonizing. It makes just so much sense to know that that's the path we're all working towards. And again, that combined stakeholder partnership, everybody doing their piece to make this happen, is a constant message to be reinforced here. And thanks for highlighting that as well. A bit of a challenging question I'm going to throw open to all of you, and you can draw straws to see who wants to jump in first. But there are some of us who have been around for a while, even before digital health was the common terminology or phrase for our industry. And would like to know, interoperability has always been the holy grail. And so from your perspective, what's substantially changed in the environment now that maybe makes this a bit more feasible, a bit more achievable? What do we think is different?
I can start, Cassie, and certainly others can actually add. So yeah, I think the journey has been from health to digital health, and from digital health to an digital health interoperability. So the journey started many years back. I think we achieved the digitization of health data. Now, what do you do with the data? Data is a powerful tool now, that we clearly are seeing could help, from whether you talk about, the timely care, the transitions of care, et cetera, et cetera. But why we believe we can achieve it now? I think, first of all, interoperability is not a start to end journey. It's a journey, as Angela actually started at the start in her presentation. So we're on this journey. We've been on this journey for a while. So we never gave up. We build these assets, various interoperable assets now. Now it is really leveraging those assets, that we have built, either harmonize them or actually connect them better to make sure that we continue to leverage or realize the benefits of those. And this is no different than some of the other our counterparts are actually going through, whether it's the NHS in UK, or whether it's the Australian framework, or whether it's the government of India that is currently going through. They're all doing the same thing. So it has been an evolution and a journey, and we continue to be on this journey. And I'm sure this will stay as a journey. It is all about how mature you continue to become over a period of time.
Great. Angela or Brent, anything to add to that? What do you think is different in the environment that would make this maybe more possible or more timely possible now?
Well, since you said my name first in front of Brent's, maybe I'll say very quickly, I think even our survey results speak to it. Only 4% of our audience today hasn't heard of interoperability. And I would venture to say that number would have been a lot higher in other years. So I think there's greater awareness of it. I think of my time at eHealth Ontario and Ontario Health working on a long-term care initiative, actually along with Infoway. And it wasn't that popular. This was around 2017 to 2019. But I also think that the last 2 years have reinforced the need for, different care settings and being able to flow information in those different care settings, whether it's from acute to long-term care, to home and community care. So I think that awareness, and also, to Abby's point, having this data, which leads to information, which can lead to evidence-based decisions as we're trying to further our health system, we know that that is anchored to interoperability. And so to me, there's a feeling of this renewed energy around the importance of it and now needing to get it right, because none of us are only going to ever be in one care setting, and we need that information to flow with us and have our providers be able to access it.
And for me, Cassie, I think the game changer is increased awareness and widespread agreement that improved that interoperability or lack thereof is a problem. It's reached the interests of the federal and provincial territorial governments. Certainly, I think the COVID-19 pandemic has shined a light on the some of the barriers to data moving quickly around the system and being used for system management and public health and other purposes. FPT governments have been collaborating on something called the Pan-Canadian Health Data Strategy over the last year or so, guided by an expert advisory group, Pan-Canadian level, presenting different perspectives on what we need for a world-class health data system in Canada. And interoperability has been identified as one of the main pillars of that. There's even been some discussion of potential investments specifically to improve interoperability in health systems across the country and to enable pan-Canadian health data to flow. So I think that's very significant, and it'll be something to watch moving forward.
That's a really good point. And maybe just as a bit of a smile and a reassuring comment for folks, I happen to have a very savvy 97-year-old grandfather who's now using virtual care through his iPad, and maybe isn't quite yet using the word interoperability, but definitely recognizes the need for his data to be able to move around with him where he wants, very patient-centric kind of vision. And so I think that awareness and that everyone rowing the boat towards the same vision is certainly here and now in front of us. And Brent, you left us off in a good spot there, talking about all that's going on in the world and in the Canadian environment related to it. So as we begin to wrap up this session, I'd like to ask each one of you a final question. And I'm going to start by framing it like this. So clearly, interoperability is top of mind for our federal, provincial, and territorial governments. There's a lot of work underway, such as what's been highlighted through our presentations and the related efforts of the Pan-Canadian Health Data Strategy, the published recommendations of the expert advisory groups, published information from our provincial and territorial governments, and as well from our industry delivery partners. So as we close out this panel, I'd really like to ask you all, what's next for each of your organizations? How does this work keep moving forward? Angela, I'll begin with you, and then Abby and Brent, you guys can arm wrestle this one out to finish.
Thank you. So I would say, more of this kind of thing, continued engagement with our membership. Clearly, our members care about this. They're very knowledgeable in this and other kinds of topics as it relates to healthcare, to be able to conduct research. And also, you just mentioned it, having that information, this little survey that we did and calling out that 95% of you or have had yourselves or a family member experience a gap in care coordination. We're not standing for those numbers anymore. And by providing these opportunities to exchange knowledge and also to conduct research is going to help move us forward. And that's certainly something that Digital Health Canada is doing as we look forward.
Right,
go ahead, Abby.
Oh, okay, I can go next. Yeah, I think what we're doing is really, this is a collaborative game. It is not one individual organization or PCHO can actually drive this. It is really identifying the roles and responsibilities of the various players in this ecosystem. Whether it's the role of policy. Somebody asked, how we can actually achieve this. Policy will have to play a role. There are levers, at the jurisdiction level and a federal level that could be used, if needed. Of course, it should be the last resort. But yeah, all the collaboration with the stakeholders, the provincial, the territorial, and the federal partners, but bringing in the other what we're designing as part of the work that we're doing closely with Health Canada is how do we bring the clinician voice into the interoperability? How do we bring some of the patient centricity into the design or into the roadmap that we plan to jointly build together. But one thing I would say is, this is really about collaborating, convening, and moving forward in an organized manner. But I think it starts with really gaining alignment on the top priority. I think the leadership has to come and align on, yes, this is the need to advance digital health interoperability, and it starts from there. And from there, you define those priorities, which results into a roadmap. And then every individual or every organization in that system will have to deliver their part, have to do its part. And that's what we've been working on in terms of defining that framework, some of the success ingredients of how to take it forward. And it's not something that we're trying to do for the first time. It is something that is very well tried and tested in the other countries, and we're trying to bring those best practices there and trying to design that.
And I think for CIHI, I think we will continue to have a fairly laser focus on the data content standards that are needed to support both patient and provider access, and for system management purposes. Very focused on primary care as an important sort of data gap area, but also looking at legacy standards as well, as I mentioned, in hospitals, long-term care and other settings, and trying to bring more standardization to that. Obviously working in a sort of a collaborative and partnership model to ensure that the data needs of the various stakeholders are, to the extent possible, all considered in that.
Excellent. Really great answers from everybody. And hopefully they've put some light bulbs on for our attendees listening to the session today, both in your presentations and in thinking about next steps forward, and how others can get involved in this work as we move ahead. So I'd like to thank you, Angela, Brent, and Abby, for sharing with us how the eHealth host organizations are working together to address these issues, to engage the community, and to move our healthcare agenda forward. So as we wind down today's program, I would like to thank our sponsors, our exhibitors, our presenters, our abstract reviewers, program committee members, and patient partners for kicking eHealth 2022 off to such a great start. And thank you to all of you for attending today. We have another full day tomorrow, beginning with our second session of ePosters at 10 a.m. Eastern, followed by a plenary on bold projects in digital health, innovating across the health system. And this will be presented by a large cast of industry leading speakers from UHN, Sinai Health System, MD Anderson Cancer Center, Saskatchewan Center for Patient-Oriented Research, and the First Nations Health Authority. So we'll call today a wrap, and I look forward to seeing you all tomorrow at 10 a.m. Eastern. Thank you.